Hi, my name is Cherry White, and I'm a Bachelor of Science in Nursing student at St. Pete College. This is a presentation for my class in Informatics. I will be discussing a mobile application that can be useful for a nurse. The app is called Murmur Pro by Hipposoft. Murmur Pro is an application to better learn heart sounds with guides to the anatomy for best auscultation. It has 23 heart sounds to study and review. It was designed for medical students, but is an application that can be useful to nurses. Murmurs can be caused by several things. A valve may not close tightly and blood leaks backwards, which is regurgitation, and sometimes blood flows through a narrow or stiff valve, which is stenosis. They are not always indicative of heart disease, but certainly any heart murmur should be assessed by a physician. Heart sounds can be difficult to discern at times, including heart murmurs. Even physicians admit that learning heart sounds and what they mean can be challenging. So this app is helpful for learning and discerning those heart sounds by having examples of sounds and information about the physiological aspects of the sounds. Murmur Pro needs iOS 4.3 or higher, which makes it only available for iPhone, iPad, and iPod Touch. It is available for download for $2.99 through the Apple iTunes Store. For comparison, the Heart Sounds and Murmurs by Hadi Yazdi is available for Android products free on Google's Play Store and offers similar sounds, guides, and information. Both applications recommend the use of headphones for hearing the sounds clearly. The format of Murmur Pro is quite nice and easy to use. Just a click for any specific sound and scroll over for further information such as the placement of the stethoscope. There is a quiz mode that is easily accessed. It is very much a learning tool and is easily navigated. For comparison, the Heart Sounds and Murmurs application is similarly designed with not as much information, and the information varies between the different sounds. Of course, nurses are not supposed to diagnose, but understanding heart sounds is good knowledge and could be life-saving for a patient. The Murmur Pro has quizzes for training, and this can be helpful to the nurse as well as the medical student. It does provide information about etiology and the pathophysiology of the heart sounds and treatment options, which could prepare the nurse for a nurse practitioner program. It was recommended by a nurse practitioner student for just that. Remember, it does not diagnose the patient itself. No waving the iPhone over the patient and having a readout of their heart health. Darn, you cannot put in patient information, so there's no potential confidentiality issues. Murmur Pro does have a disclaimer and terms of use clause, which does not hold the creators liable. You must agree to its terms. It clearly indicates that it's a learning tool and not a diagnostic tool. I would not consider this an app that is useful for bedside care. Instead, a nurse might use it later to confirm what was heard if the nurse was unsure. It is an educational app, but it does have links to other sources such as Wikipedia, Google, and Medline Plus for more information. In comparison, the Heart Sounds and Murmurs apps does not have such a link. I do not use Apple products. However, if you do, you may really want to check this app out for your use. There are also some nice packages, including the Murmur Pro, with other apps that may be very useful too. Thank you for attending this presentation.